You're listening to 102.9 WDRC, and we're well into the new year. Everybody's been making New Year's resolutions, but almost everyone wants to do something to improve their diet. Joining me today, Miles Everett, coordinator of the Bristol Hospital Diabetes Center. Good morning.
Good morning.
Now, the healthy Mediterranean diet really became popular back in the 90s. Now, what exactly is the Mediterranean diet? What does it mean that we should eat?
It's really a plant-based diet. We're really talking about making sure you get enough fruits and vegetables, whole grains, nuts, seeds. That's kind of the base for it. That's really what you're looking at.
Oh, so what food then does the Mediterranean diet mean eating less of? Because that's always the hard part.
That is always the hard part. I think one of the big things is to cut back on red meat, cut back on concentrated sweets where there's a lot of refined sugars or refined flours. Most versions of the Mediterranean diet don't say don't eat that stuff. They just say on occasion, on occasion.
Well, that's like everything in moderation, they say, right?
Oh boy, those are the golden words right there. Everything in moderation.
Now, what are the health advantages of the Mediterranean diet?
Well, they're really substantial. Cutting back on chronic diseases is the big thing. Diabetes, high blood pressure, Alzheimer's and Parkinson's disease, certain kinds of cancers.
Now, we talk about everything in moderation. When we're enjoying the Mediterranean diet, what are the portions like? Are they very small?
Yes, for the way that most people think of portions, we've sort of gotten used to hubcaps for plates. So one version of the Mediterranean diet talks about 9 to 11 servings of fruits and vegetables per day, and that sounds like a lot. But if you consider a serving would be, say, a cup of salad greens, which is really about the size of your fist. And if you have a salad, say, as a main course, you're going to get about 4 cups of salad greens. So there's 4 of your 9 right there.
Each of our food groups, what are the best choices? How do we decide?
Well, fruits and vegetables, you can hardly go wrong. When it comes to vegetables, there you want to do things like beans. People don't get enough of those. If you had a serving of beans every day, that would be terrific. When they talk about leafy greens, everybody usually goes right to salads, but there are leafy greens like kale and collard greens and turnip greens and mustard greens that are super vegetables. Broccoli, the whole cruciferous bunch, broccoli and cauliflower and Brussels sprouts, all terrific for you. You can't eat enough of those things. If you're going to overdo anything, overdo that stuff.
I noticed you didn't mention the word chocolate.
Oh, chocolate. Yes, life without chocolate is not worth living. This is true.
Miles, what is the website for Bristol Hospital?
BristolHospital.org.
And a phone number for the Bristol Hospital Diabetes Center?
860-940-6300.
All right. Miles Everett, coordinator of the Bristol Hospital Diabetes Center, helping you keep those New Year's resolutions. Miles, thank you.
Oh, thank you. It's been a pleasure.
You're listening to 102.9 DRC FM.